All right. Good morning, and thank you all for being here. My name is Sarah Davis, and I am here to present my project. Let me share my screen with you. All right. I'm here today because we must prioritize positive birthing outcomes. Black birthing people are disproportionately dying at rates 3 to 4 times higher than white birthing people. The stress and anxiety of birth plagues the Black community and has the potential to negatively affect all aspects of well-being and trust in the medical system. I'm here today as a mother and a member of the Black community who faced an adverse birthing experience with my first child due to the lack of knowledge and proper guidance and support. At age 20, I became pregnant, and as I've come to learn, I was not alone in being uneducated and ill-prepared for the transition into motherhood. I attended the childbirth classes, made my registry, packed my hospital bag, and created my birth plan for an unmedicated vaginal birth. In my mind, I did everything to get ready for what was to come. But labor was hard, harder than I imagined and harder than the movies sure make it seem. I was in so much pain and didn't know what to do. My family could sense it. My mother, sisters, and spouse looked nervous and anxious. This vibe was not in my tranquil birth plan. After arriving at the hospital, the nurse, while her intentions were likely good, was not providing any relief. Every 20 minutes, she came into my room and dangled the carrot asking, "Are you ready for pain medication now?" She kept asking and asking and asking. I locked myself in the bathroom, alone. Cold tiled floors and walls surrounding me, I sat alone, my lower back aching. Waves of nausea came and went, and my head in my hands asking the universe to please just get me through this. But the nurse, she asked again and again. And finally, I was broken. I agreed to the medication, the anesthesiologist came, and I felt defeated. 20 minutes later, my water broke and I was fully dilated. It was time to push. I had been so close, and in less than 3 pushes, my baby girl was in my arms, but my legs were numb for hours, unable to walk and isolated to the bed, exactly what I had been trying so badly to avoid. 10 years after my first birthing experience, I'm still traumatized by the lack of support and aggressive pressure from that nurse. Success looks different to different people. A healthy mother and baby do not always equal success. I am a victim of traumatic birthing experiences and long-term disappointment. After that experience, I looked for an alternative. There had to be an alternative, and there is: birth doulas. With my second birth, I was supported by a community-based birth doula and had an incredibly improved and empowering birth. No longer a victim of trauma, I am an example of a success story after being provided the necessary tools and support of a birth doula. I am a survivor. Dissatisfaction with birth can lead to long-term trauma, while satisfaction with birth can lead to long-term strength and empowerment. While the negative experience with my first birth has stayed with me since, so have the positive memories of my second birth, where I was fully supported and prepared. Both experiences have guided me in my advocacy for everyone to have only positive birthing experiences with every birth, because I see how possible it is. We should not have to birth alone. I know this because there are resources available to provide everyone access to a support person, a doula. I'm here today because all birthing people are susceptible to adverse birthing experiences, including unnecessary cesarean sections, episiotomies, trauma, and maternal and infant morbidity and mortality. You are here today because you're being called into action to combat the current maternal and infant health crises in the United States. The specific aims of my project were to review and synthesize literature. From the information obtained, I decided to then conduct qualitative research, which included semi-structured interviews with maternal child health providers. It was also intended to interview patients and community experts, but due to the time restraint, those aims have not yet been completed. The final aim was to compile the feedback and make recommendations for integrating a best practice birth doula support program at Valley Medical Center to meet the needs of the diverse patient population while also supporting the providers and staff. The foundation of this project began by conducting a review of literature relevant to the history and context of this project. I used several search engines, including Google, PubMed, Cochrane Library, CINAHL Complete, and Embase. The displayed terms were explored in a variety of combinations, and the information available through the previously listed database searches was reviewed, and articles relevant to the specific aims of this project were selected. The literature reviewed was analyzed and compiled into subsections. In the history of birthing support in the United States, literature describes the origination of birthing support. Persons playing a supportive role during labor and birth typically were female family or friends of the birthing person and have long been accepted for their integral contributions during this transformational life event. This community-based support usually originated from the birthing person's direct community, which often ensured that they possess similar cultural customs and physical attributes. In this section, Birthing Support Community Birth Doulas, you will learn that the term doula comes from the ancient Greek, meaning a woman who serves, and was adopted by birth support workers in the 1970s and 80s. Community-based doulas possess an in-depth knowledge of the community they share with their clients, allowing them to offer an approach to pregnancy and childbirth education, which is inclusive and culturally sensitive. Through shared knowledge, the birthing person is empowered to make informed decisions and communicate their needs. Birth support is a social justice issue, and doulas promote positive birthing outcomes and complement maternity care providers by offering emotional and educational support for the birthing person and family, and alleviating that role for the clinical staff during labor and delivery. The section U.S. Birthing Outcomes reviews the current maternal and infant health crisis we are facing in the United States. The United States spends more than any other country in the world on healthcare, yet has some of the highest rates of maternal and infant mortality among industrialized countries. Adverse birth outcomes affect both birthing parents and babies and include preterm delivery, low birth weight, postpartum hemorrhage, peripartum infection, perineal laceration, and high rates of interventions, including induction and cesarean sections. Each of these outcomes contributes to high infant and maternal morbidity and mortality rates, both of which negatively impact birthing parents, babies, and communities. The US percentage of cesarean deliveries was roughly 25% in 2019, though in some states, such as Mississippi, had much higher rates at 30.7%. Black birthing people are disproportionately affected by cesarean deliveries, with an increase of 61% since 1994, compared to a 33% increase among non-Hispanic white people. Unfortunately, with increased rates of this major surgical procedure, adverse birth outcomes such as infection, hemorrhage, and death are also common. Reducing cesarean rates has been identified as a public health goal of the American College of Gynecology and Obstetrics. Birthing people supported by doulas, however, are 4 times less likely to have low birth weight babies, 2 times less likely to experience birth complications involving themselves or their baby, and significantly more likely to initiate breastfeeding. The use of doulas has shown a 36% reduction in cesarean sections, improving recovery rates and birthing outcomes for subsequent births. Within healthcare, we depend on our reputation and community recommendations. Improving birth outcomes is a direct way to cultivate a positive reputation and gain trust throughout the community. The section Health Inequities Addressed with Doulas provides a deep dive into the vast differences in health outcomes among the varied populations in the United States, with Black communities and people of color suffering the worst outcomes. The use of community-based doulas provides a dedicated advocate to support the birthing person, help facilitate a safe and respectful birth, and reduce the incidence of adverse health outcomes, including factors that contribute to maternal and infant mortality and avoidable trauma. The section Social Determinants of Health and Medical Mistrust explains how the United States is a society shaped by classism and racism, with hierarchy often determined by racial and socioeconomic background. Wealth brings access and availability to healthcare and other resources. Social determinants, including education, access to quality medical services, neighborhood conditions, food availability, and more, are affected by this hierarchy and resource availability. The impact of community-wide distrust due to intentional harm caused by medical experimentation on enslaved Blacks, and deceitful treatment in research such as the Tuskegee study has not completely dissipated and still affects care today. Community-based doulas can help to reduce the feelings of mistrust and improve the relationship between patient and provider by acting as a support person and advocate for the patient. Even though community-based doulas offer an evidence-based solution to improving health outcomes, in the current state of resource availability, doula services are often not easily accessible for those who need the support the most, including members of underserved communities, and particularly women of color. Patient satisfaction and patient experience was described in detail in the next section. Patient satisfaction and experience should be at the center of our healthcare. Though often used interchangeably, patient experience involves patient assessment to determine if what they believe should happen throughout their care did occur and the frequency at which it occurred. This involves the interactions with varied healthcare professionals, from providers to nurses to administrative staff. Patient satisfaction, however, examines whether the patient expectations throughout these interactions were met or not. Thus, satisfaction ratings can differ from patient to patient due to varied expectations. When birthing people are researching care options, community recommendations, facility rankings, and personal experiences are all key roles in shaping a patient's decision to seek care in a certain facility over another. Successful birth experiences often lead that patient to return for other procedures and care needs, as well as provide positive recommendations to others seeking quality care. The literature continued to support addressing patient satisfaction through continuous doula support and thus required its own section. Recommended ways to increase patient satisfaction according to HCAHPS are to improve care coordination, ensure adequate nursing staff, and train doctors and nurses in more effective communication strategies. The presence of a community doula has been shown to increase the ease of communication between patient, provider, nurses, and other hospital staff. Doula presence can also act as a buffer when patients are treated with racial or cultural bias, which can negatively impact their birthing outcomes. Access to doula support may therefore contribute to prevention of adverse birth outcomes that disproportionately affect BIPOC communities. The next section, provider satisfaction, discusses the importance of improving provider satisfaction, which is considered the fourth pillar of the quadruple aim, alongside improving patient experience, improving health of populations, and reducing the per capita cost of healthcare. Provider perspectives play a major role in facilitating or limiting access to doula support during labor and delivery. There was also sufficient literature review discussing integration of doula services within hospital organizations and was compiled in the last section. Healthcare is in a constant state of evolution to adapt to the varied needs of diverse patient populations. The creation of care teams has been an innovative way to surround a patient with interdisciplinary and continuous support. Doulas have yet to become a fully integrated member of the care team in most hospital settings, though examples of successful integration exist throughout the United States. Providers and key healthcare stakeholders have an obligation to address patient needs regarding these ethical principles. Lack of access to supportive care reduces the likelihood for an empowered and positive birthing experience and can increase the chances that one experiences harm. The literature reviewed inspired completion of qualitative research, including providers, patients, and community maternal health experts. In preparation, first, I produced semi-structured interview guides. Each participant category received their own set of desired questions, and then I compiled an informed consent which provided the guidelines of participation, including a description of participant anonymity. Finally, I penned outreach communications to invite participation. As the principal researcher, I initiated recruitment by contacting the CEO of Valley Medical Center and requesting that they send the invitation to identified providers. I'm so grateful that the CEO agreed to facilitate, and the invitation was sent to 27 Valley Medical Center providers. For this project, I hope to receive roughly 3 to 5 participants, and in total, I am pleased to have received 4 participants. One-on-one interviews were conducted lasting 45 to 60 minutes. and the transcripts were reviewed, and the themes identified were provider experiences, existing knowledge of doula support offerings, impact, equity and diversity, barriers, provider preferences, and implementation suggestions. To begin, each provider was asked to recall their experiences with doulas while supporting a laboring and birthing person. The level of experience working with doulas varied greatly due to work environment and tenure as a midwife or obstetric provider. One stated they worked with doulas 1 in 20 births, while another stated in 36 years they may have worked with doulas approximately 40 to 60 births. They then explained that doulas are support people that can be from within the family and trained support people outside of the family, making it difficult to quantify the number of doulas they have worked with throughout their career. This speaks directly to the origination and accepted role of a community-based birth doula. Each provider was asked to describe the support they have witnessed doulas providing birthing people. The actions described were similar, but noted to be individualized for patient and situation. Actions witnessed included positional changes for labor progression, information gathering and relaying to and from the patient and birth support staff in hopes of providing a desired birth experience for patient and staff, comfort support, relieving a partner when needed, and acting as a personal cheerleader for the birthing person. When asked what populations they believe doulas were most recommended to serve, each provider stated that every patient should have access. Underserved and marginalized communities, however, were repeatedly identified as benefiting from individualized doula support. Doula presence can ease anxiety for birthing people, particularly when the doula and birthing person are culturally matched. It has the potential to increase understanding both culturally and linguistically. Other populations identified were first-time mothers, birthing people attempting a vaginal birth after cesarean, patients who themselves or a relative have a history of poor outcomes at hospitals, and members of the military or couples who are away from each other were also discussed. South King County has a highly diverse population. Each provider was asked to assess the diversity of the birthing support staff currently employed by Valley Medical Center in comparison to the population receiving care and birthing at Valley Medical Center. The providers stated the staff were previously overwhelmingly white, but have become more diverse, especially when including the nursing staff. Each provider stated that diversity does impact the birthing experience. One OB shared that the diversity increases relatability between the birthing person and support staff. It creates a difference, including a more calming presence. One provider noted, well, yeah, I mean, if it's diverse, it's great. Yes, it does affect it. How can it not? You know, if you're a young Black woman, especially, and you have an all-white staff who are older and who have been doing this for a long time and have their own ideas about who they're taking care of, I think it cannot be a good idea. All of that can affect how they act and how they interact with people. The number one barrier identified by each provider was affordability. It was noted that frequently, due to most insurances not covering doula services and the out-of-pocket costs, marginalized and underserved populations that are in the greatest need do not receive access to these services. As well, knowledge of this service was identified as not being equitably available throughout various communities. Providers also stated that the visitor restrictions put in place at Valley during COVID, which at one time reduced visitation to only one visitor, posed barriers to allowing both a doula and support person, such as a partner. Providers felt that some patients actually transferred to alternate facilities due to these restrictions. Every provider voiced a desire to participate in facilitating equitable access to doula support, stating definitely a beneficial service. They then shared preferences on integration, including open communication between patient, provider, and doula, knowledge of spinning babies, positions for labor progression and relief, psychological processes that the birthing people go through during labor and delivery, and the understanding that labor can last a long time. It was then important to gather suggestions for implementation in hopes to create the best opportunity for success. Suggestions included to have sufficient doulas available with a recommendation of 5 to 10 on call at all times, a shared baseline education and training, and facilitating introductions and relationship building between patient and doula prior to labor beginning. Some identified strengths of this project include an abundant amount of available literature. Throughout the interviews, providers seem comfortable in engaging and sharing thoughts and feelings, and providers have a strong desire for inclusivity and improved support. Providers had varied educational backgrounds and experiences, and this project was able to be completed in a short time during a pandemic when hospitals are overwhelmed and understaffed. However, limitations were also encountered, such as recruitment of patients and obtaining their feedback. The allotted time to complete was pretty tight, and no report of negative experiences was shared from providers interviewed. In the words of the provider participants, I wish everyone had one, you know? Everybody who wants one had one in their labor room. A safe transition for birthing people to ensure their livelihood and the livelihood of their babies should be a top priority. Community-based doulas have been shown to aid in providing positive outcomes. Doula support has been associated with reduction in cesarean sections and lower risk of preterm births. Achieving these improvements can result in increased cost effectiveness, which is beneficial to payers, providers, hospital organizations, and patients. So recommendations for future research include increasing the number of provider participants to at least 9 providers, complete patient interviews with at least 9 to 17 patients, as well conduct interviews with at least 9 to 17 labor and delivery nurses, connect with community maternal health experts to obtain feedback for best practices when integrating community-based doulas with the hospital organization, explore options for contracted doula services with local community-based doulas. And finally, we must determine a budget for integration of doula services at Valley Medical Center. Here you will find 9 of my favorite references, though my entire review of literature included 120 references. I'm eternally grateful for my many supporters that walked alongside me as I navigated the completion of my research and independent project. Here come the waterworks. To my children, Kiani and Sanaya, you are my entire reason, my why. I hope you look back and understand why mommy was locked in the office with her nose in books this past year. I hope you understand that the time sacrificed was in pursuit of making your world safer and to empower you to be your own advocate. Kiani, my rainbow baby, your life gave me purpose. Though you're now a big 10-year-old, you will forever be my air, the breeze that gave me life. Sanaya, the wild card, you're one of the strongest minded and loving people, a true Sour Patch Kid. You are no longer a baby, but you will always be my baby. Thank you both for giving me the honor of being your mother. To my husband, Andre, I know this year has not been easy. You have shifted and molded countless times to aid me in my dreams and aspirations. Thank you for understanding that this project and work is so much bigger than myself. To my parents, Vaughn and Sherry, for believing in me before I believed in myself and for reminding me to do so when I forget. To my sisters, Megan, Katie, and Olivia, thank you for checking in and making sure I was taking care of myself. Thank you for hearing my aspirations and believing I can accomplish them, but reminding me to treat myself with grace. To my friends and family who continue to support me, teach me, love me, and fill me with joy. To Janine Grinnell, the CEO of Valley, and the study participants, thank you for giving your time and energy to a project that means so much to me. Your feedback and support are treasured, and with your shared experiences, we will positively impact the lives of so many birthing people. To my cohort mates, Cassandra, Brianni, Faisa, Katie, Sydney, Erica, Jelena, and Nicole, I've learned tremendously from you. You each hold unique experiences, and I'm so grateful to have the honor of learning from you. The relationships we have built have been essential to my sanity. I will be forever grateful for the relationships we've only just begun this year. You all are incredible people with amazing visions to improve the world, and our WhatsApp group is forever cherished. And again, my incredible advisory committee. Kristen, your dedication and devotion to maternal child health, social justice, and the success of your students is overtly apparent. You're a rock star in healthcare, and I'm so grateful that you shared just a fraction of your enthusiasm with me. You led me to think outside of the box and broaden my thought processes. Thank you for keeping me on track to get to the finish line. You're an incredibly inspiring coach and cheerleader. Christina, your brain is truly extraordinary. Your ability to take complex ideas and strategies and break them down into easily assembled building blocks is hypnotizing. You sparked an excitement in me for research that I never knew existed, and your confidence in my skills helped me to stop doubting myself and believe in my capabilities. And to you all, my audience, thank you for lending your ear today. Now that you've become more aware of the current crises of maternal child health and the possibilities that community-based birth doulas provide, it is your responsibility to advocate for your community to ensure positive birthing outcomes for all birthing people. The end. Questions now.
Before we have questions, Vaughn Edwards, could you come off video so we can acknowledge you as the parent of this fantastic student?
Yeah, we've got, my mom is Sharon Edwards and she's there as well.
Oh, your mom is there? Okay.
And then my dad, he's there too.
Right, so let's just, before we could just acknowledge the parent. Always a parent, no matter how old the student is. Okay, so any questions for Sarah?
If no one else wants to go first, I'll go first. So, Sarah, thank you so much for embarking on this journey of actually trying out a new research method in this project. You know, and conducting primary research and collecting primary data is never easy, and there's always going to be strengths and limitations, and you spoke to that in your presentation. But you know, in hindsight, if someone else, if you were to advise another student who wanted to conduct a similar project, what would you recommend that they do that you didn't consider initially in your project?
I think that one of the biggest turning points was reaching out to the CEO and engaging the administration. One, to let them know that this was an idea and a possibility. And so then having their voice supporting that action, going out to the providers, I think that sparked that the providers even had a potential ability to have a doula system integrated. And for the people who do have the belief that this is a good role and a beneficial role, I think that spoke a lot to them. So for anyone who else is reaching out, yes, qualitative research is challenging, firsthand research is challenging, but just thinking outside of the box and like shooting high is really what I tried to do with this project.
And you succeeded. Yeah, I just such great work. I mean, and to, yeah, really have these big ideas, but to be so locally focused in this way that is fabulous. I just appreciate how committed you are to your community, and all the while working a full-time job. Oh yeah. Also, you know, I know the lack of sleep is probably catching up to you. But really just awesome work here. And after you get rest for however long you need it, what's next for you with what you'd like to do?
What's next? I want to continue this conversation. I'd hope to present it to the Equity Diversity Committee and Steering Committee at my hospital in order to have them be aware of the work that is out there and the belief that the providers have. I truly do want to impact the lives of my community and improve their birthing experiences. And so I just have to keep this conversation happening.